Hi, welcome to our sepsis podcast for September Sepsis Awareness Month. This is Rebecca Hancock at the Patient Safety Center at the Indiana Hospital Association, and today I have with me for our podcast Lindsay Weaver, who is a physician and the Assistant Professor of Clinical Emergency Medicine at the IU School of Medicine. She is also the Associate Director of Quality for the Department of Emergency Medicine in the IU Health System. We're blessed to have Lindsay with us today, and she's going to cover some content related to might my infection become sepsis. And what we know is that some of the most common sources of sepsis originate for all adults in the respiratory system, such as pneumonia. So 44% of patients begin with a respiratory infection. 21% begin with a urinary tract infection. 21% begin with abdominal infections, and 6% have skin infections. And from that, we know that oftentimes the source of sepsis. So Dr. Weaver is going to talk to us today about what she usually talks to patients about in the case of should there be a sepsis emerging from some of these pre-existing conditions. Dr. Weaver.
Hi, thank you for having me. So again, my name is Lindsay Weaver. I'm an emergency physician in downtown Indianapolis. So unfortunately, I get to see a lot of patients who have developed sepsis. So it's something that's very important, and definitely am glad to have the opportunity to talk to you about some of the things that you should think about. So sepsis is a life-threatening illness that's caused by your body's response to an infection. And unfortunately, sepsis can develop from any type of infection in anybody, and that includes healthy people. So that's why it is so important for everyone to be aware of the warning signs of infection and also how it can be prevented. And so it's paying attention to the warning signs, not only for yourself if you have an infection, but also for your loved ones or someone that you may be caring for. So first of all, prevention. The number one way of preventing sepsis is to prevent infection in the first place. So that includes getting vaccinated. Also, washing your hands when they're soiled, before you eat, after you use the restroom. And lastly, keeping cuts clean, dry, and covered. Cuts are inevitable. When you get a cut, wash it really, really good with lots of water. That's what we would do in the emergency department. Dry it, and then put a bandage on it. If you do have a cut, we recommend that you don't get it wet in like lakes, streams, but of course, baths and showers are fine. And to also keep a really good eye on that cut. And I'll talk a little bit more about that in just a minute. So despite everything that you do, the likelihood of you getting an infection at some point in your life is pretty high. It's just unfortunately something that happens. So what do you need to worry about? What do you need to look for? It's really difficult to say, is this particular infection going to lead to sepsis? Because sometimes we just don't know. But there are some people that are at higher risk. So that's the extreme of age. So elderly patients and also little kids. People who are what we call immunocompromised. So they take medicines that decrease their body's ability to respond to infection, or people that have illnesses like cancer or HIV are also really prone to getting sepsis. Another patient population is patients with diabetes, especially if like you have neuropathy where you have decreased sensation in your feet. You see those patients that develop sepsis more often. And then patients that have indwelling catheters, so if they have a line that they have to get dialysis, for example, or maybe a Foley catheter to collect urine, patients who've recently had surgery or have had to be admitted to the hospital, and also people who live in extended care facilities. Those people are also at higher risk for infection. But like I said, it could be a totally healthy person that could develop sepsis from what they probably thought was just a simple infection. If that is the case, what are the warning signs? What should people be looking for? So first and foremost is fever. When your body responds to an infection in your body, one of the signs is the amount of fever. So people who have really high fevers and shaking chills, shivering, those are all warning signs that maybe this infection is getting more broad. In the opposite, sometimes we see that patients actually get a really low temperature. So that'd be something else to pay attention to. An elevated heart rate, so feeling like your heart's beating really fast, or recognizing in the person who you care for that their heart's beating really fast. And also breathing fast. We have, some of our sepsis patients, that's the one thing they complain about is I feel like I just can't catch my breath. I'm breathing so fast. Often that is part of the fever, but it is a sign that the infection has become what we call systemic, so spread throughout the body, which is part of the sepsis process. People will complain of extreme pain or discomfort. For example, like with pneumonia, extreme chest pain with coughing, with abdominal pain. So when we think about abdominal infections that lead to sepsis, that could be like appendicitis or a gallbladder. Those infections can lead to sepsis and that overwhelming response from your body. So in those cases, it's extreme pain or discomfort. Also, people can get sepsis from cuts. So if they, had a small cut on their leg, but now they're having extreme pain and swelling in their leg, that would also be a sign that it's leading to sepsis. And feeling like you're going to die. I mean, these patients do not feel well. So if a person says to me, I feel like I'm going to die, that tells me as a doctor, I need to pay attention. And so the same thing for these people when they're at home. If they are just like, something's not right, this is, my cold is suddenly really worse, I feel really bad, I feel like I'm going to die. Those are all warning signs that maybe things have gotten out of hand and you need to seek care immediately. Extremely tired. So I always, when I talk to parents or to caretakers who are taking care of their parents and or other family members, if they are not eating normally, they're not waking up like they normally would, just really, really sleepy. Those are signs, again, that the infection could have gotten really bad and that you need to seek care. And then lastly, altered mental status. So altered mental status means to us as physicians and providers that someone's just not quite acting right from their baseline. So if your mother, maybe even if she has dementia, but she's able to typically, say hi and talk to you, but then you go visit her in the nursing home and she's not talking to you and she's just acting weird, more sleepy, that's a sign that, hey, maybe there's an infection going on. And sometimes that could be the only sign that someone has an infection. So something definitely to pay attention to. Sometimes this manifests as hallucinations. So somebody's seeing things, but often it's just not quite responding normally. When you ask a question, they kind of struggle to understand and maybe give a weird response back. So often they're not able to notice, the patients aren't able to notice it themselves. We really rely on their loved ones and caretakers to help recognize those changes. To get into a little bit more detail about the different sources of infection, and to kind of go back and I'll highlight those lists of things to worry about again. So starting with a respiratory infection, we'll often have people tell us, I thought I just had a cold, but the cold never went away, right? So I had coughing and I had the runny nose for like a week, but then the coughing got worse. And then I had chest pain, and then I developed fevers and I had shaking chills. So that would be a sign that a pneumonia has developed. I developed really shortness of breath. So if those things happen, that says, okay, this infection has gotten worse. I need to go, go to the emergency department immediately or go to your primary care doctor. I will say that, if you feel really bad and you're sick, no matter what the circumstance, the emergency department is a completely appropriate place to go for any of these warning symptoms that I am talking about right now. So for urinary tract infections. So urinary tract infections are really interesting. When someone thinks about a urinary tract infection, they always think, okay, pain with peeing, maybe some lower belly pain, feeling like you're peeing quite often, and those are definitely warning signs. But we find in our older patients that sometimes they don't have any of those symptoms. And often their only symptom that we see is what the altered mental status or the confusion, the increased sleepiness, so more of the mental things and not any of those other symptoms of the burning when you pee or the lower belly pain. And they may not even have a fever. When we're older, when patients get older, they may not develop that fever with those symptoms. So definitely something for our older patients or older population to pay attention to. If your wife is not acting quite right, bring her to the emergency department. Something could be going on. And sometimes we find that that's a urinary tract infection that could be sepsis or leading to sepsis. And also with our patients who live in extended care facilities, nursing homes, we see that quite frequently in those patients as well. When they have a change in their mental status, that's a sign of a urinary tract infection, or maybe some other kind of infection, and they need to be evaluated and started on antibiotics right away. For the abdominal pain, as I already mentioned, it can be appendicitis, it could be a gallbladder, it could be diverticulitis. There's lots of different things that can cause infection in the abdomen, and most of the time it's okay. We see the patients, we can take care of them, take out the gallbladder or the appendix, start them on antibiotics, but those things can lead to sepsis if they are not caught early and started on antibiotics, and an intervention or surgery, whatever is needed, is done right away. So I think that's, if I had one point that I wanted people to think about, is like, don't delay seeking treatment. If you're worried, we're going to be worried. So make sure that you go and see a healthcare provider to evaluate, could this be signs of sepsis? We do know that starting antibiotics early is the best thing that we can do in order to decrease the risk of death from sepsis. And lastly, I wanted to talk about cuts. Cuts, again, something part of life, something we can all get, and it's hard to say, is this cut going to turn into a bad infection? Most do not, but sometimes they do. And it could be in somebody who has, diabetes and maybe other medical problems that put them at risk, or it could be a completely healthy person. So if you have a cut, do the things we talked about, clean it really good, keep it dry, put a bandage over it. But if you notice redness around the cut, especially if that redness seems to be expanding or maybe streaking up the extremity. So if you have a cut down on your lower leg and you see some redness going up your leg, or a cut on your arm, you see the redness going up your arm, those are signs that infection could be spreading into your body, especially if you were to develop chills or fevers with that cut and that surrounding redness. Those are all warning signs that something bad may happen and you may be developing sepsis. So make sure, again, that you seek health care immediately so that we can intervene, start you on antibiotics, evaluate to see what's going on. And then lastly, I just wanted to go over those kind of high-level warning symptoms to keep in mind for yourself or for others, and that is a fever, a fast heart rate, altered mental status, meaning confusion or increased fatigue and tiredness, shivering and shaking chills, breathing faster, extreme pain or discomfort wherever in the body, and feeling like you're going to die. So if you have any of those things, then please make sure that you see someone immediately. Thank you.
Thank you, Dr. Weaver. You hit a number of very, very important points, and I thank you so much for your hands-on and lived experience of what you talk to your patients about. You mentioned about the evolution of symptoms from an infection to potentially sepsis, and how those symptoms change, how the abdominal pain, when it's worsening, is a cause for concern, and the fact that the caregivers may notice the changes in altered mental status more so than the patient may, because they have the altered mental status themselves and they just don't recognize it within themselves. So the important role of caregivers. And just as a brief mention, in older adults, what we know is that urinary tract infections are more prevalent than respiratory infections in the older adult population. So your focus on urinary tract infections and how that evolves is very, very important around these new and worsening symptoms that could be the evolution of an infection to sepsis. One more thing I'll mention is that studies are coming out that are showing that oral hygiene, or brushing your teeth 4 times a day, as well as using mouthwash a couple times a day, is reducing the incidence of pneumonia for hospitalized patients. And I could see that potentially roll over into the patients at home as well. Having better oral care could prevent sepsis as well, even though that's not largely out in all the literature yet, but there are studies out there about that. So thank you very much for attending our podcast today, and we hope you are now much more aware of the sepsis signs and symptoms because of Dr. Weaver's knowledge here that she shared with us. So thank you and have a good day.